Welcome to Health and Hygiene. Today we'll talk about how to use combined oral contraceptive pills, or COCs, correctly. There are 3 common ways to start taking combined oral contraceptive pills. The first is the first day start. Begin the first pill on the first day of your period for immediate protection against pregnancy. The second method is the Sunday start. Start the first pill on the Sunday after your period begins. Use a backup contraceptive method like condoms for the first 7 days. The third option is the quick start. Begin the pills on the day you get them, regardless of your menstrual cycle. Again, use backup contraception for the first 7 days. To maintain effectiveness, take 1 pill every day at the same time. Consistency is key. Most COC packs contain 21 active pills and 7 inactive pills, or 28 active pills with no placebos. During the placebo week, you'll have a withdrawal bleed similar to a period. If you miss 1 pill, take it as soon as you remember and take the next pill at the usual time, even if it means taking 2 pills in 1 day. No backup contraception is needed. If you miss 2 or more pills in week 1 or 2, take the most recent missed pill as soon as you remember and discard any earlier missed pills. Continue taking the remaining pills at the usual time and use backup contraception for the next 7 days. If you miss 2 pills in week 3 and you're using a 21-day pack, finish the current pack and start a new one the next day without a break. For a 28-day pack, discard the rest of the pack and start a new one the next day. Use backup contraception for the next 7 days. Here are some additional tips. Set reminders using alarms or smartphone apps to take your pill at the same time every day. Adjust your schedule if traveling across time zones to maintain consistency. Always have a backup method of contraception available. And consult with a healthcare provider before starting COCs, especially if you have underlying health conditions or are taking other medications. By following these guidelines, you can maximize the effectiveness of combined oral contraceptive pills and reduce the risk of unintended pregnancy. Thanks for watching. Don't forget to like, share, and subscribe to Health and Hygiene for more health tips.